This presentation on sharp safety is really aimed to educate the healthcare professionals all throughout the hospital system on the importance of sharp safety and the effective strategies that we can use to prevent needle stick injuries, because we know they can really have serious consequences for nurses' health and well-being. Just a list of our objectives, really to increase your awareness for the importance of sharp safety and the risks associated with sharp injuries, to also equip you with practical knowledge, skills, and strategies to prevent sharp injuries in our healthcare setting, promoting a culture of safety and responsibility among nurses in the sharps handling and injury prevention, understanding the regulatory standards and hospital policies related to sharp safety, recognizing common sources and the prevalence of sharp injuries among healthcare workers, identifying engineering controls that are there and safer medical devices available for sharps injury prevention, and learning and applying those work practice controls and safe handling techniques for sharps. Also understanding the role and proper usage of personal protective equipment in preventing sharps injuries, and learning about procedures for reporting any injury that might occur or even a near miss, and understanding the importance of that incident management. And last, recognizing the importance of ongoing training, education, and staying updated on the best practices in sharp safety. So why is sharp safety so important? Well, healthcare workers are at a high risk for percutaneous injuries because we're exposed to so many bloodborne pathogens and occupational transmission of diseases. It's estimated that more than 2 million healthcare workers worldwide sustain a percutaneous injury with a contaminated sharp object each year. And that's 25 to 90% of the injuries really actually go unreported. There's an estimated 385,000 percutaneous injuries that occur among health care workers in the United States every year. So needle stick injuries really pose a significant occupational risk within our healthcare setting, with thousands of incidents reported each year. Nurses encounter risks associated with various sharp medical devices during our daily duties, including needles used for injections, IV catheters for vascular access, and also scalpels that are used during surgical procedures. These tools are really essential for patient care, but they can pose serious hazards if they're not handled safely. Sharps injuries can expose nurses to infectious diseases such as hepatitis B, hepatitis C, and HIV, among others. This exposure not only poses immediate health risks, but can also lead to significant physical and emotional distress. The fear of contracting a serious infection can impact our well-being and may cause anxiety, stress, and uncertainty about our health and future. So it's really critical for us to prioritize sharp safety and protect ourselves and our colleagues from these potential consequences. The emotional burden of experiencing a percutaneous injury and the possibility of developing an occupationally acquired infection manifests very frequently as stress, and sometimes even as post-traumatic stress disorder, as well as anxiety, anger, and depression. So what are these regulatory standards? Well, OSHA, the Occupational Safety and Health Administration Bloodborne Pathogen Standards, establishes critical requirements aimed at safeguarding healthcare workers from exposure to bloodborne pathogens, which includes implementing essential sharp safety measures. And adhering to this regulation is vital to ensuring our safety and minimizing the risk of needle stick injuries and exposure to infectious diseases in our workplace. The hospital policies are in place that Alameda Health System has to comply with these safety guidelines. And it's really important to comply with them because adhering to those regulatory standards and the hospital protocols is really crucial to maintaining that safe work environment for all nurses. So the next two slides are from the Center for Disease Control and Prevention, and I think they really are great at depicting where some of our injuries occur and what they're caused from. The majority of the sharp injuries are going to be occurring from when we're using them, more than 50% of the time. But there is a significant amount of times that it's between steps when we're doing a multi-step process. And then also after use, before we've even disposed of them, it's 10% of the time. The data from the International Safety Center shows that since the 1990s, there has been a decline in sharps injuries due to increased use of those prevention devices. However, injuries from sutures and scalpel blades, especially among physicians, remains high. And nurses are still most affected by injuries from disposable syringes, more than 53% of the time. Additionally, about 25% of injuries occur to non-users downstream. So remember, using a safety mechanism and proper disposal not only protects you as the user, but also other people that might come in contact with the device. So what devices are involved with sharps injuries? Well, there have been several published reports that indicate that there may be a little bit of a rise in sharps injury prevention devices, such as the sharps with the engineered sharps injury protection. And the reason is many of these injuries happen before the safety feature has been activated. So it really is essential to maintain safe work practices when you're using those devices. Activating the safety feature and promptly and safely disposing of sharps are crucial steps in creating safer sharp safety programs overall. Injuries are also closely associated with certain types of devices that can pose that increased risk of blood or body fluid exposure, and those devices are typically going to be your disposable syringes, suture needles, scalpel blades, IV stylets, and the winged steel needles. So the hierarchy of controls is an industrial hygiene concept that provides structure for prioritizing interventions to reduce bloodborne pathogen exposure and reduce injuries. When you look at the top line, the elimination of the hazard, not always something that's possible, but that removes that sharp object from use. Maybe in surgery, instead of using a scalpel blade, they might use electrocautery instead. When the hazard can't be eliminated, which in many cases it can't, we want to use those engineered controls, which can really mitigate some of the injuries. There's safety engineered devices such as blunt suture needles or needleless IV connectors. They're all examples of engineering controls. When we look at our work practice, those controls reduce the likelihood of injuries and exposure to bloodborne pathogens by changing the method in which a task is performed. An example of a work practice control is using a neutral zone for passing sharp instruments or devices. Administrative controls include developing policies and procedures and incorporating safety prevention into a new or existing committee structure, and implementing an exposure control plan and providing education and training, which is what we're doing right now. The OSHA bloodborne pathogen standards requires the use of PPE where there's any risk for occupational exposure to blood, body fluids, or other potentially infectious materials after engineering and work practice controls are implemented. So that's really the lowest on the list in the hierarchy is using PPE. The best is elimination, but as I said, we can't always do that. So let's take a look at some of the engineering controls that you probably have seen and used. We have safer devices. They are there to really help with the prevention of needle sticks. They have the retractable needles, retractable scalpels, and they really reduce that an accidental needle stick. They do have improved designs, and those designs are really built-in safety features that automatically shield or retract that sharp component after it's being used. They definitely have proven benefits. Using an engineered sharp device has been shown to significantly reduce the incidence of needle sticks among healthcare workers. So what are our work practice controls? Well, making sure that we're disposing of sharps is really critical in preventing accidental injuries. Proper handling and disposal of sharps involves placing those used needles, scalpels, and other sharp objects into our designated puncture-proof containers immediately after use. This practice really does minimize the risk of needle stick injuries and exposure to bloodborne pathogens among healthcare workers. And it's essential to prioritize the correct disposal of sharps in those designated containers that are specifically designed to prevent punctures and leaks. These containers should be easily accessible to the patient care areas, and they should never be overfilled, and so that we ensure safe handling during our disposal. Another thing is not to recap. No, nurses really should never attempt to recap used needles. This is a common cause of needle stick injuries. When a safe needle device is not available and recapping is required, which is sometimes seen in the operating room circumstances, a one-handed scooping recapping technique is used. So what we do, we place the needle cap on the table, we hold the syringe only, and guide that needle into the cap. We lift up on the syringe so the cap's sitting on the needle hub, and then secure the cap into place. And what about PPE? What do we need? Well, we need gloves, face shields, and gowns. Wearing gloves that are the appropriate glove really does provide a barrier against sharps and reduces the risk of exposure to bloodborne pathogens. Our face shield helps protect our eyes, our nose, our mouth from the splashes and sprays during a procedure that might involve sharps. And the gowns are really going to help with preventing contamination of our clothing and skin when we're handling any kind of medical instruments. So reporting and incident management, because needle sticks do occur, sharps injuries do occur. So as nurses, it's really essential that we report any sharps injury or even a near miss immediately to ensure that we receive proper medical follow-up and evaluation. Prompt reporting allows for timely assessment and appropriate management of potential exposure to bloodborne pathogens. And by reporting incidents promptly, we can access necessary medical interventions, such as post-exposure prophylaxis if needed, and ensure that our health and safety are prioritized. Additionally, reporting helps identify areas for improvement in sharp safety practices to prevent future incidents and protect ourselves and our colleagues. This is just a depiction of what our employers need to maintain, a sharps injury log, to document all percutaneous injuries from contaminated sharps and must protect the confidentiality of the injured employee. At a minimum, a sharps injury log needs to include the type and brand of device involved in the incident, the department or work area where the exposure incident occurred, and an explanation of how it occurred. So documenting the details of the incident include the following pieces of information. If engineering controls were in use at that time, what was the work practice controls and were they followed, and a description of the device in use, and any kind of PPE or clothing that was used at the time, and the procedure that was being performed at the time, and any kind of employee training that was done. Documentation related to exposure incidents must be maintained in an employee's duration of employment for 30 years. So as far as training and education, Regular hands-on training on sharp safety and injury prevention techniques is absolutely essential for all healthcare workers, including nurses. This type of training equips us with the knowledge and skills necessary to handle sharp medical devices safely and effectively in our daily practice. By engaging in hands-on training, we can learn proper techniques for using safety engineered devices, safe handling, and disposal of sharps, and the correct use of personal protective equipment. This ongoing education empowers us to mitigate the risks and protect ourselves from needle stick injuries and exposure to bloodborne pathogens. So ultimately, investing in training ensures that we are all well prepared to deliver quality care while prioritizing our own safety and well-being. These are just a couple of scenarios that I found. When a nurse sustains a needle stick injury while recapping a used syringe, it highlights the importance of adhering to sharp safety guidelines. One critical guideline is to never recap used needles. Instead, dispose of them immediately in the designated sharps container. Recapping needles poses a significant risk of needle stick injuries due to the potential of accidental needle pricks. By disposing of used needles directly into a sharps container without recapping, we can greatly reduce the risk of injuries and exposure to bloodborne pathogens. So it's really essential to prioritize safety and follow established protocols for sharps disposal. Ensuring that sharps containers are readily accessible in patient care areas and that they are properly labeled and puncture resistant. Remember to never overfill sharps containers and to dispose of them according to our facility policies and regulations. Another scenario, when a nurse is accidentally stuck by a scalpel while assisting with a surgical procedure, this underscores the importance of utilizing engineered safety scalpels with retractable blades to minimize the risk of sharps injuries. Engineered safety scalpels are designed with built-in mechanisms that retract the blade into the handle immediately after use, reducing the likelihood of accidental cuts or punctures. By using these specialized safety scalpels, nurses can effectively mitigate the risk associated with sharp instruments during surgical procedures. And it's crucial to prioritize the adoption of safety engineered devices in our practice to enhance workplace safety and protect ourselves and our colleagues from needle stick injuries and other sharps related incidents. And the last scenario, when a nurse is exposed to a patient's blood during an IV insertion due to needle slip. This really underscores the importance of wearing appropriate personal protective equipment when handling sharp medical devices. PPE such as gloves and face shield play a critical role in protecting healthcare workers from exposure to bloodborne pathogens and other infectious materials. Gloves create a barrier between our skin and potentially contaminated surfaces, preventing direct contact with blood or body fluids. So it is essential to wear gloves whenever performing procedures involving sharp devices like needles or catheters. Additionally, face shields provide added protection by covering the face and eyes, guarding against splashes and sprays of blood or other body fluids. So before any patient contact or procedure involving sharp instruments, ensure that you're equipped with the appropriate PPE based on the task at hand. Remember to remove the dispose of used PPE properly after each patient encounter to prevent any cross-contamination. By consistently wearing gloves and face shields when handling sharp medical devices, we prioritize our safety and minimize the risk of exposure to bloodborne pathogens. So let's make PPE utilization a routine practice to safeguard ourselves and provide safe, quality care to our patients. So in conclusion, ensuring a steadfast dedication to sharp safety is crucial for safeguarding nurses and cultivating a culture of safety in healthcare environments. In our facility, nurses should consistently access and enhance their sharp safety protocols to proactively address evolving risks and advancements in technology. Sharp safety represents a collective responsibility among nurses, administrators, and the wider healthcare community to prioritize the welfare of all personnel.